Hello there, my name's Dr. Andy Knox. I'm one of the partners at Ashtree's Surgery in Carnforth, which is part of the Federation of GP practices around North Lancashire. We're also part of the Better Care Together team working around Morecambe Bay. I want to talk to you today about sore throats. I know how absolutely horrible it can be when you wake up in the morning and your throat is burning, it feels really tight, you can't swallow your breakfast, and you feel absolutely rough and dreadful. One of the most normal and natural things to do would be to pick up your phone and get advice from your GP. The great news is you've got a fantastic immune system which will fight off a virus on its own. And I'm going to give you some advice of how you can support your own body whilst your own immune system fights the virus away. The truth is, antibiotics make almost no difference in the vast majority of sore throats, and so there's very little a doctor can do for you in these situations. So one thing you need to do is rest and give your body time to recover. The second thing you need to do is take supportive treatment, which you can buy over the counter, just to help keep your temperature down and help keep the pain away. And there are three very simple things you can take. Paracetamol is fantastic at bringing your temperature down and controlling pain. If you also intersperse this either with a small dose of codeine or with some ibuprofen, which you can get over the counter, then you will find that keeps the pain at bay really brilliantly. So we would say take some paracetamol, 3 to 4 hours later take some ibuprofen, 3 to 4 hours later take some paracetamol, 3 to 4 hours take some ibuprofen, and that will keep your temperature down and will keep the pain at bay. The other thing which you can buy over the counter is a spray called Difflam. And if you spray that, you can use 8 sprays all in one go, right onto the back of the throat where it's very sore. And you can use that every hour and a half if you need to. And that works as a fantastic anesthetic. In other words, it numbs the throat, which makes it much easier for you to eat and drink and keep your body full of the nutrients it needs, also to fight off the virus. There are, of course, occasions when you're going to need some medical help. And I'm going to tell you about the few times when it might be that you need antibiotics and when you might want to seek some extra help. And even then, it's still up to your doctor or your nurse practitioner to help make the best decision about whether or not antibiotics are actually indicated. So let me give you the clues. They're called the Centaur criteria and they go as follows. It's a point system, and the more points you have, the more likely it is that you're going to need antibiotics. So first of all, I've already mentioned that it should last more than 5 days. If it's less than 5 days, it's less likely you need antibiotics. Secondly is to do with age. If you're aged 3 to 14, your immune system is weaker and you're more likely to need antibiotics, so you get 1 point. If you're between 14 and 44, you get no points, and if you're over 45, then you get rid of a point. The second thing to remember on this is to do with what the tonsils look like. If you open your mouth in a mirror and shine a torch in, you will see the tonsils on either side of the throat. If they've got white spots on them, we call that exudate, or if they look particularly swollen and sore, then you get a point. If when you feel your neck, you can feel that your glands feel swollen and tender, then you get another point. If you've got a temperature that's consistently higher than 38 degrees, which you can do by buying one of those over-the-counter thermometers and measuring it in your ear, then you will find that you also get another point. However, if your temperature comes down really nicely with paracetamol and ibuprofen, you're able to control your temperature, that's less of a concern. And then we'll also want to know whether or not you've got a cough. If you have a cough, bizarrely, that's actually a good sign. It's more likely to be a virus. If you don't have a cough, you get an extra point. So those are the things to look at to think about whether or not you need advice from your GP. But remember, the vast majority of times, sore throats will clear up by themselves, and trust your immune system. It is absolutely fantastic. It will fight off the virus. Antibiotics will make no difference to a virus at all. Those other signs that we talked about before are a sign that it might be a bacterial illness, and that's when an antibiotic comes up trumps and can help fight it off. I hope that's been helpful advice for you today. Do watch the video again, and remember, take good care of yourself. Plenty of fluids, rest, good pain relief. You'll be feeling a lot better very soon.